Yes, we are live. How you doing? Dr. Rob Silverman here. It's Monday. I'm happy everybody had a good weekend, I hope. I'm sitting in my office, just a little change of scenery, had a little work to do, some catch up, and I decided just to go live. As you can see, I'm all comfortable. Even the hair is a little messy. Still waiting to get that haircut. We'll see if we can get that social distancing in. Hope everybody's well. A lot of great questions over the weekend. I really appreciate everybody supporting us. Remember, let me know, like, share it, comment, give me a shout out. Let me know where you are. I always like to engage with everybody. You know, we had Dr. Jeff Bland last Friday, and since then, the questions and the comments and everything has just been outstanding. Today, we've got a lot of really good information. This is information interest, information importance. So get your pen, get your paper ready, ask a question after each segment. If I see somebody reach out and ask something, I'll answer it. So first thing I want to talk about, as we have it right here, is can gut microbes predict COVID-19 severity? Now, you even heard how I've said and Dr. Bland said on Friday, and any other guests that we have, how often we talk about the gut's importance in overall immune health. 70-80% of your immune cells are in your gut, and how your gut may be a predictor. So what they're saying now, as of April 25th, 2020, a healthy gut microbiome may improve COVID-19 outcomes. And we know that already because, again, so many of our immune cells are in our gut. It's a critical element. It's where macro and micronutrients are absorbed. We're shedding the virus before symptomology and many weeks after the abatement of fever. So interestingly enough, the gut is affected in more than half of symptomatic patients. So when patients were tested and they were symptomatic, we found out that they had gut issues. When they were negative, they still were tested for the virus to a tune of almost 25%. So the gut may be a great early entree and a very late dessert, if you will, to really understanding where COVID-19 is going. We also expressed the idea of wastewater. Wastewater will let you know in advance who's got the virus, because as they poop it out and they poop the virus out, you can trace back the wastewater before the symptomology and really understand what cities now are going to get hit. There are 20 proteins that are associated with disease severity. So they use this proteomic risk factor. So a 10% increase in this proteomic risk factor leads to a 50% higher risk of infection. So just 10% where your gut is more susceptible to damage with the proteins in your gut increases your incidence of infection by 50%. That's correlated with interesting high sensitive C-reactive protein. Those are artery sensitivities. So you're seeing the correlation not only between the gut and COVID, but the gut and also artery epithelial cells. TNF alpha, which is an inflammatory pathway. In addition to that, there's a direct correlation between that and people over the age of 58. We know that everybody over 60, that seems to be a comorbidity. So again, we believe that a lot of these hospitalizations, it's about 89.4% to 92% of the people who are hospitalized have a lifestyle or health comorbidity. So the conclusion to this whole study in reference to the gut microbes predicting COVID-19 severity is very simple. They found that the microbiome, what's in your gut, alterations occurred before the change was reflected in the proteomic risk score, making it possible that dysbiosis, unleveling of good and bad bacteria. Remember, we have to have 85% good bacteria to bad bacteria to have a proper amount of bacteria for health signals. Makes it possible because these protein alterations are not the other way around. So understanding that dysbiosis leads you down a path, believe it or not, of severity of COVID-19. As I've said before, and I believe that this article backs it up, your severity of COVID-19 may be directly related to your gut, and your gut health should be listed as a comorbidity. So I don't see anything. So it looks like it's real quiet. We're trying it a different way. You know, we're trying to make sure technology works. So now we've got some updates on vitamin D. So COVID-19 deaths are linked to vitamin D deficiency. The study here showed a simple statistic test, showed there was a pretty convincing correlation between the figures, where populations with lower than average concentrations of vitamin D also featured more deaths with SARS-CoV-2. So vitamin D, we know, is a critical element. Everybody should take vitamin D. Vitamin D was implicated if there's a deficiency in higher incidence, not only of SARS-CoV-2, but also death in SARS-CoV-2. So everybody right now should be taking D3. D3, about 5,000 IUs. D3, 5,000 IUs with K2, a little K1. D3, 5,000 IUs, K2. Take it with a meal because it's a fat-soluble vitamin. That's probably one of my first-line D defense of what I would recommend for people to avoid and decrease their incidence of upper respiratory infections. Studies are really good. The ex-head of the CDC spoke very positively of vitamin D and spoke to the idea that vitamin D should be used with everybody. Vitamin D is also should be considered a drug alteration in COVID-19. And vitamin D is being used in the ICU units, and they're getting really good outcomes on people not having to go on ventilators. So vitamin D is a great choice. I can't carry it enough. I have bottles just going through, and we still have nothing, right? I'm seeing it clean. Right.
You have something from Dave Angelo?
Oh, there you are. Hey, Dave, how are you? Thanks for reaching out. Right now, 10,000 IU is recommended. Would you recommend 20,000 for a short period of time? Absolutely. So I'm going to hit you with a like on that. Well, that should have been the like. There we go. I use 5,000 as a starting point, but the reality is the study showed that 10,000 IUs, 5,000 in the morning, 5,000 at night were the standard for the first few weeks. Then once you elevated your levels of vitamin D to 40 to 60 on a blood test, you could go down to 5,000. I don't have a problem if you have 20,000, man. Great choice. Vitamin D3 is the way to go. Did you want? No? Okay. I was just talking to the light. I caught my attention. So I'm a big proponent of vitamin D, and I don't think you'll overuse it. You know, a little study, I had a patient and got a lot of pain, systemic pain, did a large Empire blood labs, and they found out that he had really low vitamin D. It was like 20. And I also correlated with the medical doctor. So, you know, I wanted the medical doctor to look at him as well as me looking at him. And the medical doctor started with like 50,000 IUs at one time just to get the number up. So vitamin D, big choice, great call. Selenium. I think selenium is overlooked. Selenium is overlooked so much. I think it's a classic mineral. Everybody knows that we're deficient in magnesium, which is a critical mineral. Zinc, we've talked about zinc a lot. Zinc's a great choice. Zinc really helps with your immune boosting. Zinc's also great for decreasing viral replication. Selenium has shown to affect the severity of the viral disease. So it decreases the severity. How you doing? Shout out. How are you, Ellen Greenspans? Great to see you. Let's hit you with a like. I'm digging this laptop, everybody. This is a great new way for me to do this. So selenium, higher levels of selenium in the studies in China, those people at higher levels of selenium or supplement with selenium were able to recover from a virus much quicker. COVID-19 cure rate was associated with selenium status. So what you're seeing is interesting in that you're seeing people who have nutritional deficiencies get sicker easier, and there's more severity. Again, the big proponent of the severity and the extent to which this virus damages you is your lifestyle comorbidities, your health status. So while we're all not really sure when this is going to go away, I mean, if I have to see patients, I have to gear up. I've got to wear a mask. I've got to wear a shield. I've got to wear a coat. Everybody's got to come in and cover their mouth. So what you're seeing is you're just not really sure. Your best option till there's another option in addition to social distancing is without question lifestyle. Keep your body weight down. So my body fat, because we've been fortunate enough that we're able to work out. My wife's a great cook. She's a health-oriented cook, and it tastes really good. We're able to keep ourselves in shape. Don't put on the quarantine 15. That's the biggest thing I can say. Don't get healthy. If anything, start valuing your health. Thank you, Ellen. I appreciate that comment. So if anybody has any questions, feel free to reach out. If anybody has a shout out, let me know. Thanks, Ellen. I need a haircut. I think we're trying to get a hairstylist to come over here and do it. again, anybody have any questions or anything, let me know. I just want to say again, I really appreciate Friday, everybody reaching out, speaking to me, letting me know they really enjoyed Dr. Bland. That was great. Wednesday, so you guys know before we close up today, Wednesday, we're going to have professional race car driver Lawson Aschenbach. He's going to be on a Zoom. So we're going to put that up at 1 o'clock. You're going to love that. What's most interesting is that Lawson, other than being a professional athlete, Lawson also has Crohn's disease. And you will go through, he and I working through how we were able to help him get over the Crohn's disease, because exercising in professional athletes pose a major issue. So let's see what we have. Hey, Melanie, how are you? Oh, you're welcome. I really appreciate it. Thank you. She said, thank you so much for the info, KBMO Diagnostics, for the COVID-19 finger stick. Been doing a lot of great jobs with that. Let me hit you with the like. Let me answer some questions now. Hey, Trip, KBMO Diagnostic. What's up? How are you, Doc? Hope all is well. Hope to see you soon. Hopefully we can travel there. Yes, KBMO has been doing a great job. And the mask designer, I will ask about the mask designer. Ellen is a great mask designer. So if anybody needs anything, Ellen, put a link. She's making these beautiful masks. They're very, how would you say, very fashionable, and they're quite effective because everybody needs a mask. As we know, certainly in New York, we all have to wear a mask walking around in New York. So, again, I walked into the building and it was all masked up. I was thinking about doing my Bane mask thing here, but they stopped me from doing that. Hey, Trip, I appreciate it. Thanks. I appreciate you thinking I'm rocking. We're doing the info every day, Monday to Friday, 1 to 1:30. Occasionally we have some pre-recorded Zooms. Again, Wednesday, we're going to have a great one with Lawson Aschenbach. You're going to love that. And again, I'm having a blast doing these likes, these middle-aged guys. Just enjoy what's going on. So let me get to some other information I'd like to share with you. So here we have COVID-19's body's immune response affecting the brain. So really, let's talk about all right. Ellen, this is in your honor. Get ready. Oh, look at that. My wife loves this because I can't talk. Everybody just probably gave me a big thumbs up. It's the only time they've ever seen me quiet. Actually, twice. When I sleep and I wear the mask. So this is one of the beautiful renditions. They're washable. They also have filters. And I like this one. This is the one that I actually used to walk in. Everybody was shaking their head at me. And here we have another one. I can't believe that COVID-19 has got me showing fashionable masks. So here we go. So if anybody needs them, Ellen, put in a link where they can get the masks. She's doing a great job. So let's talk about the immune system. I mean, here's what we learned about the immune system that's interesting. There's some interesting words. Immune boosting. We really don't want immune boosting. We do, but when you boost your immune system, you want to boost both. You want to balance them. So here are the words that I like. Immune supporting. You want your immune system to support because it's your own natural armor. That's number one. Immune balancing. The ability from your innate immune system, which we've talked about, to be in balance with your acquired and adaptive immune system. We've talked about that also. You want immune resilience. You want your immune system to be resilient and to be able to fight off pathogens like a virus. Immune tolerance. You don't want your immune system to go aberrant just because you get attacked, because its aberrancy or its overreaction leads you down a path of cytokine storm. Immune regeneration. We have all these immune cells that come out every 10 seconds, and those immune cells allow us to produce new cells. A great choice for immune rejuvenation is the autophagy idea, where you fast, you break down your current old cells, you use that energy to make new cells so you can have immune regeneration. And immune's appropriate response. Our immune system is going to really dictate our outcome with COVID-19. Having said that, COVID-19 body's immune response affects the brain. So evidence suggests coronavirus affects the brain in addition to the lung. So let's go through this. We know that we have a gut to lung axis. That gut to lung axis is obvious, and it's multiple ways. It's through the blood, it's through the oropharynx. So the oropharynx, believe it or not, is a way to get through here, is a way to get bacteria there, and you can get lung dysbiosis or unleaveling of lung bacteria that can lead you down a path of sepsis and acute respiratory disease syndrome. In addition, your gut communicates with your lung through the blood, and your lung communicates Your gut communicates with your lung via the afferent vagus nerve. We've kind of gone through that. So the gut to lung, by the way, I have my book is late, so it gives me the opportunity to write an epilogue, that chapter at the end. One of the things that we're going to discuss is the gut to lung axis in health and disease. And people, when I said that, I got really excited about it. So thank you very much, Ellen. You're right. My wife is the best. I have to stop and give you a like for that. So in addition to the gut to lung, we also have gut to liver. Don't forget that the liver's got more macrophages than anything else. So getting back to the gut to the brain axis, if you affect your gut, you affect your brain. It's bidirectional. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. So maternal infection leads to the risk of autism-like behaviors and neurodevelopment deficits in children born to mothers diagnosed with coronavirus. We know a study that just came out that said that about 15% of women giving birth in New York City had coronavirus. 13.5 out of the 15, so it's a major segment, were asymptomatic. Only 1.9% of them were symptomatic. However, they do believe that because the main antibody, IgG, can pass the placenta, you may be affecting the child and the fetus. So other studies have explored how the virus may spread in the nervous system by a synaptic transmission. It may be communicating via axons. So the body's all interconnected. When I was on with Dr. Bland on Friday, we really turned that together. We really shared that. So understand that it's not just a virus that's going on, it's a whole body that's under attack. And because this virus is so unique, going through your ACE2 receptor sites, it has the ability to affect multiple major organs and structures all at the same time. And that's why it can be so damaging, ruinous. I call it the stealthy virus because it's got those stealthy footprints. It's real sneaky, but it's also really sticky. And interestingly enough, in some instances, you can consider it a harbinger where it jumps on something to get into somewhere else. Having said all that, don't forget, every day we're on at 1 o'clock, weekdays. If you guys have any questions, always feel free to reach out. I'll put all my tags in the front. It's been my pleasure. We're a little short today. I wanted to be a little quicker, wanted to keep it under 20 minutes. So I appreciate everybody's attention. And don't forget, in this time of need, 1 o'clock, we'll always share something health-oriented. Dr. Rob, always yours in health.